As I have said many times, in terms of public health, a lot of the work done is preventive. In fact, to have zero transmission, zero infection is the best ever public health achievement that could be made by every authority. So the purpose of doing compulsory tests and doing this restriction testing declaration, of course, is with that objective in mind, that we want to achieve zero case for the whole community. It's not just one building or one district. So we will continue to do this type of compulsory testing in order to identify any remaining silent transmission cases in community. But to have achieved a zero case, that is all residents being tested within that period were negative, is also a good sign that while you look at it, you may be worried from the public health or the building hygiene point of view about a particular area. But having gone through this test, at least the residents are much more assured that they are not living in a highly infectious area. So this is something that we'll continue to do. But as I have explained, we are choosing these areas or buildings for this sort of testing, restriction testing declaration based on a series of factors. It is not an ad hoc or arbitrary decision as such. But the number of confirmed cases in that building or district is only one of the factors. Now, this is, of course, not the only instrument or measure that the Hong Kong SAR government is adopting in order to contain the latest wave. We have been doing a lot of things, and I would refer you to read my latest monthly report on the government's efforts in fighting COVID-19, because that was a 12-month report, so I used that occasion to do a little bit of summary of the things that we are doing. It's an 8-pronged approach, covering preventing a spread from imported cases to beefing up our capacity in testing, quarantine, isolation, and so on. And we need the public support. And I hope that the media will help us to encourage residents to participate in compulsory testing and to cooperate with the government. Although we have not yet found any positive case in some of the latest RTD, that is a restriction testing declaration, we were at the same time worried that many of the units apparently have not responded to our door knocking. So whether there were individuals in that particular unit who refused to come out to do this compulsory testing is one of the things that will affect the effectiveness of the operation. Now, we try to minimize as far as possible the impact on the residents. So having done the first operation, which lasted for over 2 days, I have given this a mandate that they should aim to minimize the disruption or inconvenience to affected residents to 12 hours. So the recent operations that you have seen started from 7 p.m. when people went back to the home after work, and it should be finished by 7 a.m. as far as the so-called lockdown is concerned. So within that 12-hour period, the residents should have done their compulsory test, received the SMS indicating that they are negative and they are wearing a wristband, and they could leave by 7 a.m. back to work, go to school, and so on. So I hope residents will appreciate that we are already considerably reducing the impact on them. But as I said, this is a matter of joint efforts. It's not just the government, but the community at large has to join hands in order to contain the spread of the virus. Now, about vaccines, we have been very transparent with the community about the progress made in the procurement and the authorization of vaccines. 3 different types of vaccines have been purchased under the advance purchase agreement, and one of them, the Fosun BioNTech, has been authorized. So the latest is this authorized vaccine will come by the end of this month. Of course, we will very much make sure that it will come. But as you have read the news in the EU, there have been all sorts of things happening in the EU, and this vaccine is manufactured in Germany. So we have to watch the situation very carefully. But since we have a contract to buy, and I hope that all the other organizations will respect this contractual relationship and allow the BioNTech vaccine to come to Hong Kong by the end of this month. And the vaccination program will be able to start almost immediately, because we have got almost everything ready in terms of the number of community vaccination centers and staffing and so on. So the arrival of the vaccines and the rollout of the vaccination program we will try to condense the lead time in between. Now, about the other two vaccines, let's put aside AstraZeneca, because that vaccine has never promised to come early. That's the latter half of this year. And we could not blame them, because there's huge demand for AstraZeneca in Europe. The third is, of course, this vaccine manufactured in the mainland, the Sinovac. And we have been liaising very closely with the manufacturer. The latest is we will be given the data so that the experts could consider the data and recommend for the Secretary for Food and Health to authorize this vaccine for use. And I have also appealed to the Central People's Government if there's anything that the government could help us in ensuring the early arrival of Sinovac. The response given back to me is they will help. The Central People's Government will help. But for the time being, this is a sort of contractual purchase agreement between the Hong Kong SARG and Sinovac manufacturer.